Just went in for a normal physical to see a general practitioner, internal medicine doctor. Had been getting tested in my previous job as a pattern maker, so I knew what a PSA test was. I knew what a digital exam was.
PSA stands for prostate-specific antigen, and it's used as a marker for prostate disease.
This doctor felt a lump on my prostate, said I should go see right around the corner from his office was Urology Associates. I went in there and made an appointment. They did a PSA test at that time. That came back as positive, and after the time I told my wife, December 21st diagnosed, probably January 8th or so, told my wife and family that I had cancer. She got very involved in which doctor I was going to go to, and of the Urology Associates doctors, we settled on Dr. Butler because he was an associate of the guy I went to high school with that my wife knew from working in the orthodontist business, and he made me feel immediately comfortable. I knew that I was in for a long journey. Being 43, he was just a little bit younger than me, I would peg him at.
And so we went through a conversation and a physical examination, and we made a decision together that it would be the right choice to biopsy his prostate. We did that and diagnosed him with prostate cancer. What we're really looking for is a patient who is comfortable and confident about their diagnosis, and then comfortable and confident about their treatment choices, so they have peace of mind when they make a decision about what they're doing. After quite a bit of discussion, which we try and have with all our patients about all the various options beforehand, and after sending him to see other specialists in the area and nurses with expertise in the area to get a good, solid education about his choices, he chose to have surgery.
Then we had surgery right away, and then prognosis right after surgery was fantastic, and then it was just seeing him right after surgery, released me from the hospital, healed up for a couple of months, went back to work, and then started seeing him regular every 3 months with the PSA test and the digital to make sure I was healing okay, and then extended beyond that to 6 months, a year.
It takes a long time to build trust with patients and to convince them that what you're going to do is going to really positively impact them.
And then just recently, 2015, PSA went to 0.1 and then doubled from basically March of 2017 to September of 2018. And at that time, we decided that we would go the full beam radiation route and knock it out of my body once and for all. And here we are today with virtually no side effects, and still just keeping on, living my life. It's fantastic. I just got back from a trip to Canada on the motorcycle.
And so it takes a time to convince them and build trust, and then when that comes through and they do well, it's really fantastic.
But I would say mostly it was just how comfortable he made my wife and I feel, and how just sitting with him, talking about us and distracting us from the major situation we were going through, and asking about children and asking about what we were planning to do with the rest of our lives. So not focusing on exactly what we're going through today. Yeah, you got a surgery, and yes, you have cancer, but that's just one little chapter in your life. What are you going to do next?
We have a team of really dedicated people, from the receptionists to our nurses, to our medical assistants, to our PAs and advanced practice nurse, and our doctors, and our practice administrators, and our billers and coders that are committed to an organization that's all about the patients and how do we do their best for them.
It's about living. It's not about worrying about whether you have cancer again. He told me that's his job to worry about. My job is to go live my life. And he's been kind of a partner between my wife and I and him through that since I was 43. I look at those people as they saved my life twice. So it's pretty cool.